everyone. This is Cole Lyons from the American Journal of Healthcare Strategy. And today with me is Audrey Lyons. And Audrey, why don't you introduce yourself?
Hi, everyone. I am Audrey Lyons. I am currently an administrative fellow at Advocate Health up in the suburbs of Chicago, Illinois. Originally from Florida, just finished my Master's of Health Administration from the University of Central Florida. And I'm very excited to be here with Cole today.
And we're so excited to have you. As you were saying earlier, there's two lions talking to each other here. Not related as far as I know, but you never know. We'll have to get some a 23andMe testing done at some point here. So I think it's so interesting. You've come from Florida and then all the way up now to Chicago, very different areas, which is excellent. And that's one of the reasons why we wanted to talk to you. But also because University of Central Florida is a very popular school. Thousands of students come out of that. So tell me why you actually chose University of Central Florida to begin with.
So I was born and raised in Tallahassee, Florida, which is kind of like, it was a small town. Now it's growing with two major colleges and then a community college. And I just knew once I finished at Florida State that I did not want to be in Tallahassee anymore. And so I was like, let me get out of Tallahassee, but let me not go as far. So I didn't want to do anything drastic and move all the way up to Chicago at that time. Or any other far state. So I was like, Orlando seems like a good option. It's a good midpoint between Tallahassee if I want to go back home or if I want to drive down to Miami for the beach. But when it came to looking at programs, UCF had their mission and values kind of aligned with what I was looking for. It wasn't very specific, like not a specific cohort or anything like that, but it was more flexible. I was working full time. I knew I wanted to continue working full time. And they had that flexibility when it came to picking out classes because it was considered full time if you were taking 3 classes. And most of the classes were either in the evening or there was an option to do some during the day. But you could balance it out, whatever worked with your schedule.
That's really nice. So you were able to did you work while you were doing it?
Yes. So I
Okay.
was working full time, but I also ended up my third semester being there. I started my graduate assistantship. So I was able to juggle both of those while also doing school full time.
Nice. That's really impressive. I know that that's one of the reasons that I went with Jefferson's online MBA program is because of the flexibility. I mean, there's lots of, elite programs out there that are full time. And one of the things that we wanted to showcase is that, there's still lots of fellowship opportunities for people who do hybrid programs and who do
Mhm.
online programs. And I think it's a really important thing because people come from all different backgrounds and all different situations. And I wanted to actually talk about that a little bit too. What did you feel about the tuition? Did you feel like it was pretty reasonable? Did you encounter any unexpected expenses you'd want to warn people about? What was that like?
Tuition wasn't too like expensive or anything. So from undergrad, I was fortunate enough I didn't have to pay for undergrad because of like grants and everything.
Nice.
But becoming an adult and going into the real world, you figure out that you might have to pay for your own classes. And so I ended up taking out some loans, which it was my first time, a big scare. But I knew if
Yep.
I worked for a nonprofit organization for long enough, they might pay for it. But it wasn't anything too extravagant. I think each semester was around $3,400 or so. And then with the graduate assistantship, that covered about, I want to say like 75 to 80% of my tuition. So I still had about $1,800 to pay, but that was taken care of from my loans. And I was able to take some of the money from my loans and continue to like live off of that along with the full-time role that I had. So no
Nice.
unexpected costs. Books weren't too expensive. You can usually find PDFs online for the book. So that was really
Nice.
good.
Well, that's really good. So if there's, and I'm sure there probably is going to be some students from UCF or who are looking at UCF going there, not to worry too much about anything unexpected coming up. I know that at some schools they had some like very expensive books that were like only in paper form, but you said that it's mostly online, so that's great. That's really good. And with that, how long was the program? Was it, you said 2 or 3 years, I think?
2 years exactly. That's how long it
two
took
years.
me. But there
Oh,
was a
perfect.
mix of people that did like part time, so it took them a little bit longer. And I think there are some people that sped it up and they finished in a year and a half or so. But
Oh,
I wanted
nice.
that
That's
full
that's great.
experience, so I did a full 2 years.
That's good. That's good. And do you feel like it was good value for the money and for the time?
Absolutely, I was able to just meeting the professors and being able to network with other people, and just grow with them. I feel like I absolutely got all of my money's worth.
That's good. It's always nice to kind of go through it and then not regret it, which is another thing about, I think, some students. MHA programs have pretty good success, but that's not the true with all grad programs. So it's nice to hear when people are happy about
Yes.
their experience. I guess, another question I think is having gone through the experience and then getting into a fellowship. That's a successful outcome. But what do you think that grad programs at large could do better, or could replicate from your experience to engage students more?
Great question. I would say, well, question back to you: is it more so prepping them for fellowships, or just like the real world when it comes to those healthcare leadership roles, or what specifically?
I think it's whatever you think is important. I know that there's that kind of debate, and I'd also like to hear your opinion on whether programs should prepare students for a fellowship or should prepare them for actual kind of practice, because there's some of these programs that require students to do the fellowship,
Mhm.
and then there are some of these programs that don't require it or really encourage it. And so I think there's kind of two ways of looking at it. And so I think another question back to you is, do you feel like a fellowship is something that should be required in a lot of programs? How do
Mhm.
you feel about that?
So, to answer that question, should they be required? I wouldn't say required necessarily, just because there are a lot of fellowship programs out there, but there are so many people that are competing for them, so it makes it a little more difficult. And I also know some people, rather than going the fellowship route, they like to go the consultant route. Or there are some people like myself that don't know 100% what they want to do. So, making sure you don't give them like a specific requirements like, oh, if you don't get a fellowship or consulting, you can't graduate, kind of makes it more difficult for them to figure out what they want, rather than being in a position that they don't want to be in, and being stuck there. So I definitely don't think it should be a requirement for programs. It wasn't a requirement for my program. It was encouraged. I think with my graduating class, or just within a time span of when I graduated in a couple semesters back, 8 of us got a fellowship. So that was very exciting to see from University of Central Florida, especially with a newer program. And as they continue on, a lot more people are applying and get accepted to fellowships. So that's really exciting. But it is by no means forced or required at the University of Central Florida.
So encouraged and not required. I think that's a good model, because like for me myself, and for a lot of people, especially people who've been in industry for a while, some of them would have to take a pay cut, and I've heard that that's been prohibitive for them pursuing an MHA, especially if they have families. Some people have kids younger than others, so it's good to encourage but not force. And so, do you feel like you were supported um, and enabled to get the fellowship in a way that didn't make it too difficult, or do you feel like programs at large could do better at that? What's your view on that?
I absolutely believed I was supported and encouraged by the best professors that are out there, when it came to me looking for fellowship. So I wasn't looking for a specific location or fellowship anywhere. I just knew I wanted to apply somewhere. I wanted to get accepted and just learn as much as I can from wherever I went. But my professors and even my directors of the program supported me wholeheartedly, writing my like letters of recommendation, looking over the programs, connecting me with people that might be from that specific program or was once there. So they definitely supported me with that. And I feel like when it comes to other programs supporting their students, I think they should absolutely try to network them, or at least connect them with people that were once there, and encourage them, not require it, just because, like you said, there are people that have families, that have kids, or like those full-time roles that they're not able to just give up willingly. Um, so it makes it a little more difficult, but encouraging them, if they want to go that route, to continue going down that route, and to support them wholeheartedly.
That's great. Yeah, and I think the way that you were supported sounds really good. Having professors who you can connect with who are on your kind of on your team makes a big difference. How many programs did you apply to? Was it a bunch, or were you more targeted?
I applied to 20 programs. I did 10 on NAFCAS, and then I did 10 off of NAFCAS.
And then did
And
you
it
have to do
was
a bunch of in-person interviews, or was it mostly like digital at the time?
from the 20 that I applied to, I want to say I had at least half of those responded because there were some that didn't even respond whatsoever, which
Yeah.
is completely fine. But then for first round interviews, I want to say I got 5, and then second round were, I want to say 3, and then in person ones, I was flown out for one, and then I was offered another one to go to, but I declined it just because it didn't really align with what I was looking for. Um, and so I want to say I had at least 2 final rounds,
Nice.
and then got
And with the
advocate
flying
privilege.
out, just want to ask about that because, and same thing with the not responding. Like these are things that I'm thinking of from some of the medical students I've talked to, where it's like really annoying, but they just won't respond, and you won't be able to find out why you were rejected. And same thing with the flying out. Now, when you say you were flown out, did they pay, or is that something that usually you have to pay for in the fellowship industry?
So from what I know and from hearing from like some of my co-students, my classmates, there we go. We were all flown out for our interviews. So flight was
Okay.
taken care of.
Nice.
Uber and taxi, whatever was, if we had to pay, they reimbursed us for it. And then hotel and food was covered.
Nice. So maybe a little bit better treatment for the administrative students than some of the medical students. I've heard that medical students sometimes have to incur huge expenses when
Yeah.
traveling. So that's nice that that was taken care of. So
Yes.
that's very interesting. I like that. And I think medical students should be treated the same way. I think we should all get, if we have to go for an in-person interview, I think they should cover it.
Yeah. Yeah. It would
So I
seem
like
fair.
that.
You would think.
Yeah, exactly. I think that's good. And and of course, that's the one that you flew out to and that you ended up going to was in Chicago.
Yes. It was
And
in
what
Downers
made you
Grove,
choose that?
Illinois. What made me choose that? Great
Yeah,
question. It was just flying in and just like seeing the area of the hospital that we were touring that was in Downers Grove, Illinois. I just really liked
Downers
the
Grove. Okay,
area. Yes, Good Sam and Downers Grove. Absolutely loved the area. Was able to meet the president, Ali Weiler, who is now the president of Lutheran General. That's going to be in like the Central Chicagoland PSA and everything. Meeting her, and she is a former fellow of the program. And so just hearing about how she went through the program, and like now she's a whole president of a hospital. Now she's a PSA president and hospital president. It was just amazing to hear that and me thinking that could be me one day. So it just really clicked with me. And then one of the other big things that I love to tell people about why I chose this area is because when I came up here to interview, I had to go to Target to go get snacks. And this was probably the most amazing Target I had ever gone to. And then after I went to Target, I was hungry for dinner, and I ended up walking to Jersey Mike's. And on my way to Jersey Mike's, I saw that there was a barbecue spot, and I absolutely love barbecue. And that is
oh,
my
nice.
favorite restaurant that is in the city. So that was
That is great.
cherry on top for me to move up here.
That's great. Definitely something I'm gonna have to pass on to our administrative fellowship people is making sure we advertise our restaurants and Target locations.
Yes.
That's a good. Those are some good points. And then you mentioned that the inspiration was kind of seeing people within the program that had gone up. Are you considering staying with the same institution, or are you looking elsewhere?
Absolutely. I am considering and hoping that I stay with Advocate Health, especially since we are growing. So instead of just being in the Midwest, so Illinois and Wisconsin, we are now located in North Carolina, South Carolina, Alabama, and Georgia. So that gives me more opportunities. I can move down to a warmer state because I am from Florida, and this Chicago weather is not my forte. Um, but there's also just more to learn and more to see, especially as our organization continues to grow.
That's great. It sounds like a really good organization to be a part of. And with that in mind as well, what do you see yourself doing 5 or 10 years from now? What are some things that really motivate you for the future that you're really excited about?
5 to 10 years from now, good question. So first and foremost, my plan is to get my doctorate in health administration in the upcoming years. So with that, once I get my doctorate and everything, I want to be able to go into universities and teach students that essentially look like me, because I will say that is something that I kind of missed in my program, was that I didn't have a person of color that was a professor that went through the same thing that I went through or has gone through the same thing. So that's first and foremost. So as I am a healthcare leader, I also want to be a professor and share the knowledge that I learned throughout this whole process with other students that are going through this process. But from a leadership role, Great question. I'm trying to figure that out still. It'd be nice to be a hospital president, just being able to be in that like day to day motion, that operation of how a hospital runs. Um, and just to be able to like lead people. But my downfall is that I just love to travel so much. So I want to be able to juggle both of those, being
Yeah.
able to have that work life like synergy while also like leading people, but making sure I'm staying sane and being able to see the world.
Yeah, so a consulting role or
Yeah.
maybe a kind of corporate president that gets to travel to the different. I mean, since there's so many states now involved, that would also be a cool opportunity. I'm actually really interested about the Doctorate of Healthcare Administration. So I don't think there's that many doctorates of healthcare administration kind of programs. It's more of a new kind of a new field. I'm a huge supporter of doctorate programs. I think that it's great to get people as knowledgeable in the practice and then also to share that with others. Have you already begun researching what doctorate programs you're looking at?
Yes. So between I've been toying between a DHA and a DRPH, but I think I'm leaning more towards the DHA just because I want to continue in that health administration route and just get more knowledge in there. Just because you also don't see a lot of individuals with that DHA. So I've been looking at programs and trying to figure out where my next move will be. I've looked at some schools in South Carolina, some in Georgia, and just trying to figure it out. The benefit of that is that most of them are online. So wherever I move to next, I am able to do it while I'm still working.
That's great. That's yeah, that'll be good being able to apply to what you're learning or apply what you're doing to what you're learning and vice versa. I think that'll be even kind of a continuation.
Mhm.
It'll be really nice. What do you feel like in terms of the equity kind of that we started to discuss a little bit? What do you think that administrators at schools can do to make it more welcoming for diverse groups? Because you said yourself, you didn't, even though you felt supported at your program, you didn't always, you say, get people who looked like you
Yeah.
to be able to really network with. What do you think schools could do better?
So I don't know if it's a school issue or is it just leaders that aren't going into the education role. But if they can work hand in hand just to get more, I'm not going to say influence, but more diversity of individuals that are in healthcare to start sharing their knowledge, sharing their experiences with up and coming students because um, a lot of people need it. I missed it. I enjoyed my program. I love my professors, absolutely. But it would have been nice to see maybe a Black woman that was in healthcare leadership
Mhm.
or a Black gentleman or Hispanic,
Yeah.
Asian, somebody that's kind of had to fight a little bit harder than their other counterparts in their program and also in their leadership role. Just because what I was told growing up is that I'm going to have to always work 10 times harder than my counterparts just because I'm not going to be seen as the same level as them. So, looking for those leaders that essentially look like the students that are applying to the program and that are in the program would be very beneficial.
I mean, I can't imagine, I guess, to that level what that would be like, but I do know that in terms of income level, I face challenges where sometimes there's groups where there's schools where everyone's a fairly high income, especially, I went to a private school and most of my tuition was covered by my employer. But a lot of the students, it's a private school with high tuition, so a lot of people are paying out of pocket, and people didn't always understand like my mentality in terms of trying to chase certain salary levels. I'm already married, I have family I'm trying to take care of, and sometimes there was a disconnect between that I had experienced. And so I can't imagine kind of even amplifying that, like you're saying, having to work 10 times harder.
Mhm.
I feel like that's something that we really should address. And I really hope that maybe we could have you on again in the future as you get your DHA to possibly kind of investigate further what we could do to improve that. Okay, so another question that I had is, you're a talented professional. You've been through your MHA program. You're and starting to get close to the end of your fellowship, but a lot of companies and hospital systems say that they have a hard time attracting talented individuals like yourself, and they even have a harder time keeping them. What are some experiences that you had? You said you were interested in staying with Advocate Health. What can other organizations learn from your good experiences that you've had to try to be better and attract talent and then keep the talent?
So I will say Advocate has evolved. I feel like they're more up to date with certain things. So we keep a lot of our talent here, not just leadership, but also just like frontline employees. And so one of their big things is just making sure like listening listening to employees and making sure that they're heard, and appreciating them. So whether that's pay, benefits, I know here specifically at Good Sam, everybody knows everybody. So just walking down the hallway and just speaking to someone, or like listening to a story about their life, or just hearing about their kids or something like that. Teammates appreciate that, and I personally appreciate that. So when I'm meeting with leaders, I'm making sure they're meaningful conversations, but also remembering what they tell me, and hopefully they remember what I tell them. So when we meet again, maybe we can catch up and just be like, hey, how are the kids? Oh, did you catch the football game or something like that? So just making sure that organizations, leadership are making meaningful connections with their teammates, because nowadays people are quick to leave to go to another organization that might be paying a little more, but might not appreciate their staff the same.
Yep, I've seen that as well, and I've seen the differences between organizations that have that personal relationship and those that don't, and it really does make a big difference. Like you said, even people will leave even for a 5% pay increase. So
Yeah.
I think those personal relationships are important. Do you feel like your MHA program and your fellowship equipped you to be a leader in an organization, and I guess specifically a people leader? Sometimes people learn a lot of the book knowledge and they do really well, but they struggle with people leadership. Do you feel like these programs can help people in that area?
Absolutely. So being very vulnerable right now. When I came into the fellowship, and probably up until December, I really did not want to be a people leader yet, just because I want to be able to have that confidence, that knowledge, and even that vocabulary when it comes to leading people. But after just like being in the fellowship, talking to my preceptor, reading, and just taking like a holistic view of like where I see myself further down the road, I've decided that I want to be a people leader right after I finish the fellowship, just because I need to get comfortable being uncomfortable. And thinking about being a people leader kind of makes me uncomfortable, but I know to get better in that role, I need to be in it and practice it. So I feel like in the fellowship, it has absolutely prepared me, along with my master's program, because it's prepared me as well with networking and being able to walk into the room and talk to leaders that you get imposter syndrome or like intimidated by sometimes. So I feel like both of them absolutely prepared me. And I still for sure have some things that I want to work on and I need to work on. But the fact that I know that and those are things I'm actively working on, I feel like puts me in a good position to become an even better leader.
That's encouraging to hear for me. I'm not done with my MBA, and I haven't really done a fellowship or anything like that yet. And I know that I don't always feel confident being ready to be a people leader. So it's nice to know that eventually I'll get there.
Yeah. I will too. Don't worry.
Yeah, I mean, you seem like you're doing really good there. Your LinkedIn presence seems really great. You speak with a tremendous amount of experience and passion, and I think your goals, especially surrounding equity, are really really important. And I think that organizations who have a mind to the future are going to see that and realize your talent. And I guess that's another question too: is where do you think the healthcare industry is going in the next couple of years? What do you think the future of healthcare is?
Great question, because it's in our hands in the next few years. So hopefully it's going to be even better than it is now, just because there are some areas that we need to work on. But I do know, like, for instance, AI is going to be something that's continuously talked about and will probably be even more prevalent in the next 5 to 10 years. So that's something we need to keep our eye on. But making sure that we're focusing on that, like, physician burnout, the nurse burnout, and the frontline staff burnout, because everyone's tired from having that pandemic in 2020 and still having hardships that are happening now. Everyone's burnt out. People are leaving the healthcare industry. So I feel like with our generation that's coming up to become leaders, making sure that we appreciate our staff so we can keep our staff, let them know that they're the reason that we're still going. And just making sure that we continue to try to make it better, just because the way it's looking right now, it's up to us to fix it.
Mm-hmm. Yeah, I agree. I think with Epic, we've seen that they're integrating some charting features with AI that are going to make it easier. But there's also been some concerns about AI and its impact on kind of equity, some of the work that we've been doing. Some people are worried that it's going to kind of revert back on that. Have you seen anything yourself or had any concerns that some of these new technologies are going to actually lead to worse discrimination instead of better?
Um, I don't know. So personally, I haven't. I've followed AI and the new technologies and everything, but I'm not gonna lie to you. It kind of scares me just because technology is so scary,
Mhm.
and the way that it's going. I've never used Chat GPT. I can't bring myself to do it. But I know as we continue, just seeing like how intricate technology, AI, all of that is, it's going to be a little bit scary, especially for like different departments that can be taken over by technology and everything. Now, I don't think healthcare leaders will disappear because of robots and everything, but now we're doing more surgeries with robots, and central scheduling is done with automation almost. So just paying attention to those different areas and remembering that we also have people that we can utilize instead of turning everything to technology that sometimes does not always work.
I appreciate that. Remembering the people. That's a very important. Well, that'll have to be a quote on the ad for this episode. I like that. So I guess because some of the final questions, we have grad students who are just starting their program. We have those who are finishing their programs. What are some of your recommendations for these graduate students now that you have the experience, you've been through it yourself?
So 3 words I will say: network, and last one is to network. Just because nowadays it's kind of about who you know and not what you know, and just being able to have that presence and that, I guess, the confidence when you're going to talk to big wigs or people that you might want to work for one day. Um, Knowing how to speak to them, how to be in those rooms. You might have imposter syndrome. I still get imposter syndrome. But before I go into those rooms, I do my power pose and I listen to my, power up music and everything that's going to make me brave when I go in there. And then I handle my business accordingly. So just networking, making those meaningful connections, because that's how you're going to get further into life. So I make sure when I'm going into different rooms and everything, whether it's at my organization or at other organizations meeting with other people, I'll throw in my best friend who is also a healthcare administrator down in Florida, or one of my other good friends that's in his fellowship over in Detroit, Michigan. So making sure that I like name drop wherever I am and making those connections with people that will probably help me further down the line.
I think that's excellent advice. How did you get started networking? I know for me at first, I was really terrified to contact anyone who wasn't directly at my at my peer level. So, how did you get started with that?
Honestly, I think it's like a genetic kind of thing because my dad can talk to anyone and everyone. And I am my father's child. So wherever I go, I could be at a restaurant talking to the waiter or waitress. Hey, where you from? Where are your people from? Where did you go to school at? What do you want to do long term? Do you
Nice.
know this person? So since I was young, I've been practicing networking and it has brought me a long way. And so it's just something I continue to do.
That's great. That's nice to have those genetics, but also good advice as well. Just to strike up those normal conversations with people, I think is can be really powerful. So
Yes.
that's really great. I really appreciate you so much coming on. We're just starting this series, and we've been able to have really excellent conversations with people like yourself. And I know it takes a lot of time out of your day, but I think it's really meaningful for our audience. So I want to thank you so much for coming on and speaking with us.
Absolutely. Thank you for having me, Cole.